going to be talking about something that is, I wouldn't say really heavy, but something to take note of, right, when it comes to stroke. And the reason being is that this study was conducted last year, and the stats came in. And did you know that 1 in 4 Malaysians may suffer stroke by 2040 if no prevention action taken, right?
Exactly.
So this is something to be worried about, I would say.
Exactly. We mostly speak about, you know, heart attacks, we talk about other diseases, and whenever somebody talks about stroke, they naturally think, especially I think people our age, they naturally think like, no one lah, I won't get one lah. I'll probably get it when I'm older, you know, I'm healthy, I don't have any diseases, I feel fine.
That's
but
right.
as we were speaking to our guest offline just now, he says that brain attacks, people don't naturally or immediately address it because you don't feel pain in the brain compared to a heart attack when it's very painful. That's why immediately you're like, oh no, I feel this, I wanna immediately go. But sometimes we spoke about this as well, you know, you don't feel all of the symptoms until towards the end when you're lying on the floor. But before we invite our guests, I do want to pull up this stats as well. Like Brendan mentioned, the National Stroke Association has actually cautioned that stroke cases are on the rise among the young, with 15% of ischemic strokes occurring in young adults and also adolescents. So this is why it's very, very important for us as well to address this particular demographic, the younger generation. That means what?
I would
45
say
and below?
45 and below, that's right, and some even 30 and above. Now, I'm sure you are also well exposed to cases where young people are getting stroke. More often than not, yes, they unfortunately get heart attacks as well. But I don't know why, in most cases, people will just close that one eye, thinking that it's just too young and there's no way in whatsoever stroke would hit them until it actually do. So that's why we are here. We don't want that to happen to you or to any of your loved ones out there, to your friends, to your closest partners or any of that sort. So that's why we are going to be talking about this. We're talking about stroke in younger persons, and to help us understand this even more, we brought into the studio Dr. Lau Jia Him, interventional neuroradiologist.
Good morning,
you for
Brendan.
being here, Doctor.
Thank you.
First questions first.
Yeah.
We are what we are, and people always say you are what you eat, you are what you eat, those kind of stuff.
I thought you were gonna go like, you eat what you are.
I get
no, don't eat any humans.
I get confused as well. So would you say that often than not, younger persons, when it comes to stroke, is because of what they eat?
It's one of the main factor, but there is other factor also. So for any diseases, now even heart attack, patient getting younger and younger, because I think there is a change in our lifestyle.
Right.
Yeah. So very important. We work well, we eat well, we exercise well, and then we sleep well. And the last thing, we must take care of our hygiene well. That is what you call healthy lifestyle. It helps to prevent all sorts of diseases. Of course, we are human. We will suffer from disease one day. But if we live a healthy lifestyle, then we are healthier for longer, okay? So our health depends on us. We have to work on it. But when you are not well, you have a disease, then you see doctor. Doctor will try to help you. Then I always tell patients, my job as a doctor is get you across the river. After I put you across the river, you still have to go walk on your own. That means you still have to continue to live a healthy lifestyle, okay? Chinese has a proverb to say that the calamities come out from your mouth and a disease go into your body via your mouth. So we must take care of our mouth.
That's a good line. Can you say that in Chinese? Yeah, go ahead.
祸从口出, 病从口入. That means the calamities come out from your mouth, and then disease go into your body via your mouth. That is what you mentioned, because they are eating habits.
Oh my God.
Yeah. So our Malaysian, we have 2 delicious food. When you have delicious food, that means sugar level is high, salt level is high, oil level is high. So that is what you get. You know, so you have diabetes, you have hypertension, you have high cholesterol. So this is 3 important factors that lead to stroke, and then especially in younger people. And then even heart disease is the same thing. So I always tell my better half, everything must be less, sugar must be less, Salt must be less, oil must be less, but money should not be less.
Oh, wow. I love the last bit. Everything should be less, but money should be more.
Yeah, money should be more.
So before we get into actually preventing or understanding strokes itself, we need to know the different types of stroke. Because earlier I mentioned we have something called the ischemic stroke and also a hemorrhagic stroke. In less fancy Latin terms, in layman terms, can you explain to our audience what does that mean?
Yeah, ischemic stroke means you had the blood cannot reach your brain.
Okay.
Why the blood cannot reach your brain? Because
stuck in a traffic jam.
Yeah, the blood vessel is blocked.
Okay.
Right? Okay. How is it blocked? There is 3 levels. One, there is a problem in the blood vessel of your brain, inside your brain, is narrow.
Okay.
Once the blood vessel get narrow, the blood flow becomes slow.
Right.
Once the blood flow becomes slow, it clotted.
Okay.
Right? Imagine you slaughter chicken, you pour the blood in the bowl.
Yeah, bowl.
It just solidify. So if your blood flow in your brain slow down, it's also solidify.
Right.
It's no more a fluid that flows.
Right.
Yeah.
Then it block.
Right.
So once it block, the blood cannot reach that particular area of the brain, then it dry off and it dies. Every minute, 2 million brain cells die if the blood didn't reach the blood cell.
This is really taking the term, my brain cells are dying, to a literal term.
Yes.
Okay.
And then a brain cell, once it dies, it is difficult, it doesn't recover.
Right.
Okay.
But other area of the brain will take over the damaged area. But it takes long time.
Right.
Sometimes it doesn't take over fully. Sometimes maybe 60%, 70%, 80%, 90%, all fully.
Right.
But we cannot tell when the patient have a stroke.
So then
it takes at least 6 months for patient to recover.
Yeah.
So then patient cannot take care of himself, have to depend on somebody else, the family, or have to employ a worker to help out. So this is a huge burden to financially and also to patient and family.
And the other type of stroke?
The other type of stroke is bleeding, happen. Then you damage the certain area of the brain, you know, so then you cannot move one side of your body. And that commonly happens because patient didn't realize they are hypertensive, especially young people. They don't feel anything. Then suddenly the blood pressure too high, the small blood vessel in the brain burst and they bleed, and then they cause a stroke. And if the clot is too big, more than 3 cm, it will press on the brain, and patient can collapse and die.
Yeah.
And then it can compress. The patient can lose consciousness. So the surgeon can to open out the skull and take out the clot to reduce the pressure, and even lift the skull bone to let the brain to relax. Otherwise, you know, patient can die because of that.
Right.
Yeah.
It's too, when you put it, I guess, in a more simpler terms, it's as if you're in a room, and the room is filled with water, and that there's no window, there's no door to kick open.
Because especially young people, our skull and the brain is almost equal.
Same size.
Same size.
Okay.
Once you have bleeding, suddenly increase in volume, so the pressure inside increases.
Right.
Okay.
So you have to decompress.
Right.
Yeah.
Now, doctor, just a quick one here. Of course, high blood pressure, I wouldn't say it leads to stroke, but it could be one of the causes for stroke.
One of the cause.
Okay.
Yeah,
But
if it's too high, blood pressure too high, the little tiny blood vessel can bleed, and then patient has a stroke.
Okay.
I can tell you one incident. My own friend, he works in hospital, and he just feel like, how can my handwriting so terrible today?
Yeah.
Then he called me, so I asked him to come quickly, and then I get my friend, a neurologist, to see him. And then my neurologist do physical examination. Then he said patient had a stroke. So he immediately asked for an MRI to confirm it. And very lucky for my friend, it's a very small bleed. Then he recovered fully.
Wow.
So it's important. I have only one message today. If you think you have a stroke, please go to hospital quickly. Whether it's stroke or not, doesn't matter.
Yeah.
So time is the most important thing.
But how then can we, as because you mentioned earlier that you don't necessarily feel anything that goes on in your brain. I feel a lot of my thoughts, but I don't feel actually things physically moving. So how can we then perhaps maybe some of our audience who are feeling a little bit cautious right now? Do I just go in and be like, hey, I want to do a brain scan?
No.
Then how does that work?
There is an acronym. So be fast.
Okay.
B means it stands for balance. If you feel like today you are not unable to walk straight, you are losing balance, you better go to hospital quick.
Okay.
It can be stroke, but it can be something else. But that let the doctor check for you. So you need to worry. Let the doctor worry. Then be fast. E is eye. So if your eye have the eyelid is closing down, your pupil is big or small, or you cannot move your eyeball one side, then you also go to hospital quick. Okay? And then face. If your F is face, when your face is drooping, then it can be stroke, it can be something else. Also quickly go. Okay? Then fast, A, then you're not moving one side of your body, arm. So that also an indication that you should go hospital fast. And then speech. Suddenly you become slurred, then you go. Okay? And time, T, time is very important because every minute save your brain cell. Because 1 minute, 2 million brain cells die.
Yeah.
Right.
So imagine if you've had it for, let's say, even 5 minutes, that's 10 million brain cells dying.
So when you suspect you have a stroke, please go to the nearest hospital.
All right. Now, doctor, what happens if I'm alone and this happened to me?
Then you call ambulance.
And do you tell them that I think I'm having a stroke?
Yes.
It's very important.
Yes, very important that you tell them, I suspect I'm having a stroke. So they will come as early as possible.
And they will advise you.
Then they will send you to the nearest hospital possible.
Okay. So once we've gone through BFAS, BEFAS, again, it is the brain, the eyes, the face.
Balance.
Balance. The balance, eye,
face, arm, speech,
and also your time, right? So in an instance where I am going through a stroke or I see somebody going through a stroke, what should we do? Because the only thing that I know is that when a person goes through a stroke, you got to make sure that they lie on the side and they don't lie back, right? Because you don't want them to suffocate.
So they can have vomiting. Then they can aspirate. That means they suck in whatever they vomit into the lung.
I see.
Then they will cause infection in the lung. That will be another trouble. Can drown. And then if they are not conscious, their tongue can drop back to their airway and then block their airway, then they cannot breathe. So you have to turn them to the side so that this doesn't happen.
Okay, so essentially we're going to try and see it. So I have to lie down on the side like this. Oh my goodness, I'm so sorry. This is probably not the best way to show you guys, but you have to make sure that your patient is lying down here, right? Okay, and you have to tilt up the head?
Yes.
All right. I would do it to you, Brandon, if we could, but no space here today.
I hope, that you don't have to do it to me.
Yes, I hope not. But again, if you go through all of this, if you have a friend or you, son, daughter, mother, father, whoever it is, again, make sure they lie on the side, make sure the head tilts up, and make sure they don't aspirate or choke on their own vomit or saliva or any.
And wait for help and go to the nearest clinic or probably even hospital. Hospital, don't go to clinic.
Not clinic.
All right, and doctor, of course, with that being said, right, and we talk about time, you told us why time is actually very important.
Yes.
Okay, we're done with the scary stuff right here, so let's talk about the treatments and stuff like that, doctor. So what can you tell us about the treatments?
So once you reach hospital, they will quickly do a scan. They will do a CT scan and make sure it's not bleeding, right? Because if you are stroke because of bleeding, the treatment is different. If the non-bleeding, then the treatment is different. So they will do a CT scan, then they will do a CT angiogram. The angiogram means a picture of the blood vessel. It's done on the CT scan. Then from there, they can know whether the blockage is a small blood vessel or big blood vessel. Okay, if this is in a small blood vessel, the neurologist will give you thrombolytic agent immediately in the CT scan itself.
Right.
So this medication will go to your body, whole body, then they will lyse the clot in the smaller blood vessel in the brain. Okay? So if it's a bigger blood vessel that it blocked, then it becomes my turn to help. So I stick a needle in the groin, in the artery, then bring the catheter up, do the angiogram, see the location of the clot. So first, I will put in a tube, which is 6 French in size, 3 French equivalent to 1 mm. Diameter. That means six French is 2 mm diameter.
Right.
So I push my catheter, which is very soft, and go to the clot and push it in and suck and take it out. So it can be done very fast. Within half an hour, everything is done. If this doesn't work, sometimes it cannot come out, then I will put in a stent.
A stent?
You know? Yeah.
It sounds like a hard thing, right?
Yes, it's the same.
Okay.
But this stent is attached to a wire.
Okay.
So because this stent is a tube, it's a metal tube, it's a 19-or metal tube. They use laser to cut many holes, and then it can be squeezed into a wire. So then you push it over the clot, and it opens out, and the clot is like jelly. It will sit inside the stent, and then we pull it out, also with suction, and then the clot is out.
Yeah, I've seen this on Facebook.
It's like it's like fishing the clot out.
Right.
So, but you must choose the right patient. If the brain is already too big an area that is damaged, if you do this, the blood gush in, then the patient will bleed. So you must choose a patient that is come very early, and the area of damage is small, then this is a very effective treatment. So patient cannot talk, one side of the body cannot move. After you fish out the clot, and the damage before you fish out the clot is small, patient can start talking immediately and can lift the hand immediately. Next day he can walk home. This is a wonderful treatment. But you must choose the right patient. If you don't choose the right patient come too late, and then it's easy to remove the clot. It looks very nice on angiogram. You have done the perfect treatment, but the blood gush in, then later on it bleed, and then brain swell, then patient had to go to take out the skull bone because you need space to relax. Then patient will be stuck in the ICU bed for a long time. And the cost of maintaining an ICU bed is 5,000 to 10,000 a day.
It's costly.
Because one patient is taken care by one nurse, 3 shifts, 24 hours. And it costs a lot of money.
All right. So, Doc, unfortunately, we got to wrap things up. We have about 30 seconds left. Can you quickly remind our audience, again, who are watching at home, if they choose to, again, do a screening round now, right, to do a health screening, perhaps. We do love health screening to check, like for me, I've done it mostly for my lungs, my bones and whatnot. So, for our audience at home who do want to do a health screening, do they also tell the doctors, hey, I also want to kind of do a CT scan or a brain? How do I approach your
If you want to do screening, you go to the health clinic. Don't go to hospital. Because they are for different purpose. So you go to health clinic, then they can do health check for you. Then you tell them any discomfort, any complaints you have. They will see you. Once they see you, they can guess roughly 70%, and either you are healthy or you have some issue. Then they will do some blood tests and scanning to double confirm. That's it. So the most important thing, my last message is, we need to live a healthy lifestyle. Work well, eat well, sleep well, exercise well, and take care of our hygiene well. Then we live a healthy, long life.
And go earn your money.
I love that, Doc. Thank you again so much for coming on the show. Again, ladies and gentlemen, remind everyone at home, it is Be Fast, okay? You can rewatch all of the acronyms, what does Be Fast mean, on our Instagram. It is @freshbrew_RTM.